Hello everyone, this is Pathak and you're watching my channel. Today I will talk about hospital policies of the rest of the chapters of NABH Standards 5th edition, which is the organization-centric chapters. You can also follow my Instagram account, which is present on the slide, which is Healthcare for You Forever. So let's get started with this particular presentation. So I will talk about the policies under chapter number 6, patient safety and quality improvement. So the first policy here on the slide is clinical audit policy, which talks about the procedures to be followed while conducting the clinical audit. Then policy 2 is patient safety program policy, which talks about the patient safety program as to how to be conducted, how to maintain the patient safety in the hospital. Policy number 3 is quality improvement program policy, which talks about the quality improvement techniques to be followed in the hospital. Policy number 4 is incident management system policy, which is very important because incidents happen in the hospital again and again, and it's very important to manage them. Then policy 5 is sentinel event policy. So sentinel events are those events which can cause harm to the patient. So like patient fall, like wrong surgery on the wrong patient or on the wrong organ of the patient. So these are sentinel events. So let's move on to the next slide, which is the chapter number 7, responsibilities of management. So let's talk about the policies under the responsibilities of management. Policy 1 is ethical management framework policy, which talks about the ethical management in the hospital. Policy 2 is staff rights and responsibilities policies. So it talks about the rights and responsibilities of the staff as to how to maintain the decency in the hospital or decorum in the hospital. Then policy 3 is service standards policy. Policy 4 is risk management policy, has to how to manage the risk in the hospital. Can be any type of risk, fire risk or risk of the patient fall or anything. Then chapter number 8 is facility management and safety. So let's talk about the policies under this particular chapter. Policy 1 is equipment replacement disposal policy. Policy 2 is spill management policy. Policy 3 reprocessing of single use equipment policy. Policy 4 is operational maintenance policy. Policy 5 is exit plan policy. Policy 6 is fire and non fire emergency policy. Policy 7 is gas manifold policy. So spill management basically means that if there's a spill occurring in the hospital, like chemical spill or any spill which is very hazardous, okay, so that needs to be managed. Okay, generally it occurs in the microbiology department or laboratory department, but it can happen anywhere. Then there's some operational maintenance policy, like how to operate and maintain the appliances in the hospital, like air conditioners or any other device. Then exit plan policy, how to exit the hospital whenever there's an emergency or whenever there's a disaster in the hospital. Then fire and non-fire emergency policy, so if there's a fire, as to what to do in that particular case, which fire extinguisher needs to be used in that particular case. Then gas manifold policy, that there are many types of gases which are used in the hospital, like carbon dioxide and many other gases which are used in the hospital. Then equipment replacement disposal policy, like what kind of equipments are used in the hospital. So this all is there in this particular chapter, facility management and safety. Now comes the chapter number 9, which is human resource management. So policies under this particular chapter are recruitment policy, as to how to recruit the staff in the hospital, any kind of staff. It can be managerial or clinical staff. Okay, then policy 2 is training and development policy, as to how to train and develop the you know employees in the hospital. Policy 3 is grievance handling policy, how to handle the grievance, the problems of the staff. Human resource planning policy, as to how to plan the human resources, like what kind of staff are required in the hospital, how many are required. Policy 5 is performance appraisal policy, as to check the performance of the staff in the hospital, that how they are doing in the hospital, whether they are doing well or not. Disciplinary procedure policy, as to how to maintain the discipline in the hospital. Then privileging and credentialing policy, as to check the privileges of the staff in the hospital and their credentials, that what they have done in their education. Last chapter is information management system. So let's see what are the policies under this particular chapter. First is retention of medical records policies. Some medical records are basically retained for a particular period of time. Okay, then policy 2 is medical record policy. Policy 3 is record security policy, record confidentiality policy, record integrity policy, then access to record policies. So these are the policies under these particular chapters. I hope you really like this video. Thank you for watching my video. I hope you really like this video. Please do not forget to like, share, subscribe my channel, and let's get um, you know let's meet in the next video.